Are you training to be a lab assistant or already working in the lab and want to sound more confident using medical terms? Let's break down common medical terminology that every lab assistant should know, explained in simple language. CBC Complete Blood Count. CBC stands for Complete Blood Count. It checks red blood cells, white blood cells, hemoglobin, and platelets. It's one of the most common tests processed daily in the lab. Hemolysis. Hemolysis means red blood cells have broken apart in the sample. This usually happens if the blood is drawn or handled incorrectly. It can affect test results, so samples must be collected and transported carefully. Fasting. Fasting means the patient didn't eat for a certain time before the blood draw. Tests like glucose, cholesterol, and lipid panels often require fasting. Always check for fasting status before processing the sample. So, venipuncture is the process of drawing blood from a vein using a needle. You know, as a lab assistant, you might not always be the one drawing blood, but you'll definitely be working with samples that came from a venipuncture. Serum is the liquid part of the blood after it clots. Plasma, on the other hand, is the liquid part before clotting. Different tests require different types, so it's really important to always use and label the correct tubes. Culture and sensitivity, or CNS, is a test that checks for bacteria in samples like urine wounds or throat swabs. It also finds out which antibiotics can kill the bacteria. This is actually a very common test in microbiology labs. STAT. STAT means urgent or immediate. When a test is ordered STAT, it should be processed right away, no delays. It often comes from the emergency room or critical care units. Alright, so reference range. This is the normal range for a lab test result. Lab assistants don't diagnose, but it really helps to understand what's considered normal or abnormal when handling results. Next up, pathology. Pathology is basically the study of disease. Lab assistants help prepare samples, like tissues or biopsies, for pathologists to examine and diagnose. Let's talk about chain of custody. Chain of custody is used for legal or sensitive tests, like drug screens. It means tracking every person who handles the sample. Everything must be signed, sealed, and documented carefully to prevent tampering. These terms are just a few of the basics you'll hear every day in the lab. Don't worry if you're still learning. It gets easier with time and experience. If you found this helpful, like the video, leave a comment, and subscribe for more lab assistant tips, medical knowledge, and career support. See you in the next video.